Hi there everybody, welcome back to my channel. Today I wanted to talk about an important topic, which is adhering and sticking to protocols when it comes to eye drops for a certain condition that you may have. If you want to learn more about this, then please stay tuned. After you have been diagnosed with the clinical condition that you have, the treatment that you require for this condition will be very specifically and carefully outlined for you to yourselves. Now, the important thing with this treatment protocol is that it needs to be adhered to in order to try and get the best outcome for your clinical condition. If I use a few examples to explain what can go wrong, then hopefully you will understand the importance of sticking to this guidance provided. Example number one is a patient who begins with anterior uveitis. So if you want to learn more about uveitis, then please watch this video on uveitis, which I have previously made. Uveitis is a condition where you get inflammation within the eye. Now, it's important to start regular treatment and intense treatment, and this could be every hour for the first couple of days. Now, the aim of this treatment is to try and reduce inflammation. Moreover, the aim of treatment is to prevent this inflammation from spreading further back into the eye and potentially affecting the middle layers of the eye, and then also potentially the back of the eye. The further back into the eye the inflammation progresses and travels, the risk of more serious complications increase. This is why it is fundamentally important to stick closely to a treatment protocol and regime when it comes to an inflammatory condition such as anterior uveitis, because the other issue that can arise is if the inflammation spreads to the back of the eye, then in addition to needing topical, i.e. drops for the eye, you may also require tablet steroids, for example, which carry significantly greater side effects and risks to your general health. The other example I wanted to share is that of glaucoma. Now, in glaucoma, it is a condition on the whole that most patients are diagnosed as having without them actually having any symptoms. This is true for the initial phases of the disease. Now, in glaucoma, what happens is ultimately you will be put on pressure lowering eye drops, and this keeps the pressure low and therefore reduces the risk of damage occurring to your optic nerve. If the optic nerve fibers get damaged, then this will result in you losing your visual field, i.e. your peripheral field, and the worst case scenario with this condition is you could be left with tunnel vision. The importance therefore in this condition to adhering to drops is so important. Now imagine there's a condition that you've got that doesn't really cause you much in the way of symptoms until it gets to quite an advanced stage. You're using drops to try and lower the pressure to try and prevent this from occurring. But if you don't use the drops, the condition could progress so significantly and so quickly that by the time you become aware of the issues that you have, such as reduced peripheral vision, then at that stage, unfortunately, it's too late. Patients, therefore, who don't stick to a treatment protocol regime provided to them will unfortunately end up losing significant amounts of vision, and once it is lost in a condition like glaucoma, it's not reversible. The other condition to speak about here is that of an infection, and commonly a contact lens related infection, when a patient will develop an ulcer on the front of the eye. Again, it is not uncommon for patients to be required to use eye drops every hour for the first couple of days to try and get on top of the infection. Now, if these treatment protocols are not adhered to, the infection could become rampant, and something that starts off as a inverted commas simple infection on the front of the eye could spread through the middle layers of the cornea, and then it could even lead to the formation of an abscess and intense inflammation within the eye. Now, this abscess and intense inflammation within the eye are much more difficult to treat and require a longer treatment protocol. So it really is in one's interest to stick to treatment protocols. Another common condition where patients may be required to use treatment over a long period of time includes patients with idiopathic intracranial hypertension. In this condition, the idea is to try and keep the pressure within one's brain and spinal cord low, therefore not compressing the nerve within the eye and therefore not causing visual damage and changes. If the pressure increases and this pressure is sustained, then you can get damage to the nerve fibers, which, similar to glaucoma, is irreversible. Another very common condition in which adherence to treatment protocol is fundamentally important is that of dry eyes. Now, dry eyes is a condition that is chronic and it needs to be managed appropriately, and patients need to stick to the treatment guidance provided, because otherwise they will get frequent flare-ups, and those frequent flare-ups will require more intense treatment regimes and protocols. Now that I have armed you with lots of knowledge about how different eye conditions can suffer with the inappropriate treatment protocol being followed, the important thing to outline at this stage is, if you do have potential issues that you know about, or you foresee potential issues, then mention them to your eye care provider so that they can work with you to try and advise you on how to manage those issues appropriately. For example, you may have rheumatoid arthritis and it may be difficult for you to put in drops regularly, or it may be physically challenging for you to actually get the drops into your eye. There are ways around this, and aids can be given to help you put the drops in, and with liaison with yourself and family, they can also help you to put the drops in also. It may be difficult for you to actually obtain the drops in the first instance. Again, guidance can be provided on how to get these drops. You may be traveling abroad and want to know whether you need to continue with the same treatment protocol as initially discussed. Again, discuss it with your eye care practitioner and then they will advise you on how best to proceed. The reason I'm outlining these issues is because I remember seeing a patient once, and unfortunately, due to the pandemic, the patient was unable to obtain drops. Subsequently, the patient did not put these drops into their eyes, and then what happened was the pressure within their eyes got out of control, and subsequently they lost a lot of their visual field and peripheral vision. When they then came back to our eye clinic 3 years later, unfortunately the patient was essentially registered as being sight impaired. I hope through watching this video you've learned and gained an appreciation of how important it is to adhere to treatment protocols. Please do give it a thumbs up, subscribe, please like, comment and share videos. Thank you so much. Until next time.